All right, so let's dive into something kind of, I don't know, maybe a little freaky.
Oh, yeah.
Necrotizing fasciitis.
Ah, yeah.
Which I think a lot of people, they hear that and they're like flesh-eating bacteria.
Right.
It's a horror movie.
Yeah.
And, you're probably here because you saw a headline somewhere that caught your eye.
Mm-hmm.
You're the kind of person who just likes to be in the know when it comes to health.
Yeah.
But either way, we're going to unpack the facts.
Absolutely.
Cut through the scary stories.
Yeah.
And give you the information you need.
For sure.
So to do that, we got some medical websites.
Okay.
We got doctors on YouTube.
Oh, interesting.
Weighing in.
Okay.
And even a personal story that that I think really shows how quickly things can go sideways with this. The interesting thing is necrotizing fasciitis is way less common than most people think.
Right.
But it can become so serious
so
quickly that understanding the facts is really crucial.
Absolutely.
So first things first.
Yeah.
What exactly are we dealing with here? What is necrotizing fasciitis?
Well, that whole flesh-eating thing,
Right.
It's a little bit of a misnomer.
Okay.
It is a bacterial infection,
Mm-hmm.
but it's not like the bacteria are literally chomping their way through your flesh.
Okay, so what is actually happening then?
So the bacteria release these toxins that damage the fascia.
The fascia?
Which is that connective tissue right under your skin.
Okay.
But here's the thing. It's not just the bacteria themselves causing all this damage.
Okay.
Your body's own immune system is actually a huge player in all of this.
Really?
Yeah.
So our own body is making this worse.
Yeah, it's almost like your body's defenses in trying to fight this thing off are actually making things worse.
So why would that be? Why would our body's response actually make the infection worse?
So imagine your immune system like an army.
Okay.
That's fighting off an invasion.
Mm-hmm.
Right. With necrotizing fasciitis, this army is so powerful that it can actually damage the surrounding tissue.
Oh, wow.
Just in its attempt to defeat the enemy.
Wow.
So this intense reaction that's happening combined with those bacterial toxins that we talked about, that leads to that really rapid destruction of the fascia. And the faster this destruction is happening, the harder it is to treat.
Yeah, I've heard that things can get really bad in just 24 hours. Is that right?
Absolutely.
Wow.
One of the sources compares it to trying to fertilize your lawn with a really short hose.
Okay.
So you can only reach a small area, right?
Right.
Leaving the rest of it dry and vulnerable. In the same way, if the blood supply to the area gets cut off, antibiotics, which would be our fertilizer in this case, they struggle to actually reach that affected tissue.
Oh, I see.
So the infection spreads like crazy.
Wow.
And the damage just becomes much more severe.
So how would you even know if you had this? What are some of the signs, the things people should be watching out for?
It can be really tricky because a lot of those early symptoms, they just mimic the flu.
Okay.
Body aches, fever, chills, that kind of thing.
So you might just brush it off as like, I'm just getting sick.
Exactly. But here's where it gets concerning.
Okay.
The pain at the site of the infection, it becomes incredibly intense.
Okay.
Way out of proportion to whatever the injury might have been.
Yeah, and looking at some of these sources too, like the visuals are pretty disturbing.
Oh, yeah, for sure.
Like, how would you even describe that?
The descriptions, I mean, they're pretty vivid.
Sure.
You see redness, swelling, and like discoloration of the skin. Those are the initial signs.
Okay.
Then you might start seeing blisters.
Oh, wow.
That are filled with this weird fluid.
Oh, gosh.
And then even like a crackling sensation as gas builds up beneath the skin.
Oh, that's just,
yeah.
That's not good.
No.
Yeah, one of the sources tells this story about this, this 12-year-old girl.
Oh, wow.
Who just scraped her toe on vacation in Florida.
Oh, jeez.
She was having trouble walking, then excruciating pain, and it turned out to be necrotizing fasciitis.
Yeah.
And that's the part that's so scary to me is it's like it can happen to anyone.
Right.
From what seems like a really minor injury.
Yeah.
And this source said if she'd waited even a day longer.
Oh, gosh.
It could have been fatal.
Wow.
So it's one of those things where it's like, you really do have to pay attention to these signs.
Absolutely.
And not just dismiss it as, oh, it's just a little scrape or, oh, it's just a bug bite or whatever.
Right.
You really do have to pay attention if you're having intense pain.
Yeah.
Especially if it's accompanied by these other visual changes.
Absolutely.
So you mentioned that this can happen to anyone.
Yeah.
Is there a certain group of people that's That's at higher risk than others.
There's certain things that might make you more susceptible to it.
Okay. Like
what? If you have a weakened immune system.
Right.
Maybe because of conditions like diabetes, or if you're on certain medications, those can increase your risk.
So it's kind of like a balance where it's like you got to be aware of the risk factors.
Yeah.
But it doesn't mean you're going to get it.
Right.
And it doesn't mean you're immune just because you're generally healthy.
Exactly.
But how rare are we talking? I mean, one doctor, on one of these YouTube videos, said he only sees a case every few years.
It is incredibly rare.
Okay.
But because the consequences can be so severe, it's worth understanding.
Yeah.
You know what I mean?
Yeah, so it's a balance of being informed without, freaking out.
Exactly.
So necrotizing fasciitis is rare.
Yes.
Thank goodness.
Yes.
But there are different types.
There are.
And it's important to understand what those are.
Yes.
So let's unpack those different types then. What makes them unique, and why is it important to know the difference?
Okay. So the most common types are type I and type 2.
Okay.
And they often appear in different parts of the body.
All right, so let's start with type I. What makes that one unique?
So type I, sometimes you'll hear it called polymicrobial necrotizing fasciitis.
Okay.
That one's kind of like a bacterial team effort.
Okay.
It's caused by a mix of different bacteria, often kind of working together to cause that infection.
So it's not just one, it's like a whole gang of them.
Exactly, yeah.
And where do those infections usually show up?
You'll often see type I in areas like the abdomen or the groin.
Okay.
Yeah.
And what about type 2? You mentioned it usually shows up in different places.
Yeah, so type 2 is more of a solo act.
Okay.
It's usually caused by a single bacteria, either group A streptococcus, which is the one that causes strep throat, or Staphylococcus aureus. You might know it as staph.
Staph, yeah. So bacteria we've probably all heard of. But in this case, they're causing a much bigger problem.
Right, exactly.
And so type 2 usually shows up in different places than type I.
Exactly, yeah. So type 2 is often found in the extremities, like your arms and legs.
Gotcha. It's kind of unsettling that these everyday bacteria can suddenly become so dangerous.
That's the thing about bacteria. They're opportunistic. They can be totally harmless in one situation and deadly in another.
So knowing what type it is helps the doctors figure out the best way to find it.
Oh, absolutely.
Sure.
Different antibiotics work against different bacteria. So knowing who you're dealing with is really, really crucial.
Yeah, going back to that whole thing about the body's own immune response, it's like, it's almost like a double-edged sword in a way, right?
Right, yeah.
Like it's there to help us.
Yeah.
But it can also cause more problems.
Absolutely. I mean, while your immune system is essential for fighting off infection, in the case of necrotizing fasciitis, the response can be so strong that it actually contributes to the damage.
So how does that work? How can the immune system actually make things worse?
Okay, so think about it like this.
Okay.
The bacteria, they release those toxins.
Right.
And that triggers what's called an inflammatory response. It's kind of like sending out an alarm to call in the troops.
Okay.
But in this case, the troops end up causing some collateral damage.
Oh, wow.
In their attempt to neutralize the threat.
So it's not just the bacteria that's eating away at the flesh.
Right.
It's our own body's defenses that are actually causing a lot of the damage.
Exactly.
Wow. So that makes that whole flesh-eating label even more misleading.
Yeah, yeah.
Because it's not like the bacteria are literally chomping away at the tissue.
No.
It's more like they're setting off this chain reaction.
Yeah.
And our body kind of amplifies it.
Yeah, that's a great way to put it.
Okay, so we've got these different bacteria causing the infection, and then our body's own response kind of adding fuel to the fire.
Right.
No wonder this thing can spread so quickly.
Exactly, and that rapid progression, that's why it's so important to get treatment as soon as possible.
So let's talk about treatment then.
Okay.
What do doctors do when somebody comes in and they think they might have this?
The first step is to confirm the diagnosis.
Right.
And that can be tricky because those early symptoms, as we've discussed, they can look like a lot of other less serious things.
Right.
So figuring out if it's really necrotizing fasciitis, that can be a challenge.
Yeah. So how do they figure out if it's really necrotizing fasciitis?
They rely on a combination of things.
Okay.
A really thorough physical exam is crucial.
Okay.
So they'll be looking for those classic signs, that intense pain, the discoloration, the swelling.
Right.
But sometimes the visuals alone, they're not enough.
So what else do they do?
Blood tests can be helpful.
Okay.
They're going to look for things like elevated levels of white blood cells, and inflammatory markers, which are signs of infection, basically.
Okay.
And they can also use imaging tests like CT scans or MRIs. Those can give them a better look at what's happening under the skin.
You know, I remember reading about this scoring system.
Yeah.
Called LRNEC.
Oh, yeah, yeah.
What is that all about?
So the LRNEC score is basically a tool that doctors can use to figure out how likely it is that someone has necrotizing fasciitis.
Okay.
Based on the results of those blood tests.
So it takes into account all those different factors.
Exactly. It looked at things like white blood cell count, C-reactive protein levels, even blood sugar levels.
Gotcha.
And basically, the higher the score, the greater the chance that it's necrotizing fasciitis.
So it's kind of like a way for them to gauge how worried they should be.
Yeah, exactly. Now, it's not a definitive test, in itself, but it's another piece of the puzzle that can help guide treatment decisions.
But even with all those tests, sometimes they can't be totally sure.
Right.
Until they actually go in and look. Right.
That's right. Sometimes surgical exploration is the only way to confirm the diagnosis.
Oh, wow.
And a lot of times, that's actually the first step in treatment.
So they're diagnosing and treating at the same time.
Exactly, yeah. During surgery, they can see how bad the infection is and remove any dead or infected tissue. That's called debridement.
Yeah, and everyone always talks about the finger test.
Oh, yeah, yeah.
Which sounds pretty intense.
Yeah.
I mean, what is that? Yeah,
it's basically a way for surgeons to quickly assess the fascia. During surgery, it's not the most pleasant image, but, it really highlights how serious the infection is.
Yeah. All right. So surgery is obviously a big part of treating necrotizing fasciitis. But what about antibiotics?
Antibiotics are absolutely crucial. They're usually given intravenously in really high doses to try to kill the specific bacteria that's causing the infection. But here's where it gets a little complicated.
How so?
Remember how we were talking about how the body's immune response can actually make it harder for the antibiotics to work?
Yeah, because all the swelling and inflammation, it makes it tough to the antibiotics to reach the infected area.
Exactly. And that's why surgical debridement is so important. It takes away the source of the infection and creates a much better environment for those antibiotics to do their job. It's kind of like clearing a path for the medication to get to where it needs to go.
So it's kind of this two-pronged approach.
Exactly.
Surgery to get rid of the infected tissue, and then the antibiotics to actually kill the bacteria.
Right.
And sometimes, I know depending on how bad it is, doctors might even consider additional things like hyperbaric oxygen therapy.
Oh,
That's that thing where they put you in a pressurized chamber.
Right? Yeah.
And you breathe pure oxygen?
That's it.
I mean, what's the thinking behind that?
So the idea is that increasing the oxygen levels of the tissues that can help fight infection and promote healing.
So it's like giving your body an extra boost.
Yeah, exactly.
To help it recover.
Yeah. Now, it's important to note, research on this, on hyperbaric oxygen therapy, it's still ongoing. It's often used as what they call abjective therapy, which means they use it in addition to standard treatments like surgery and antibiotics.
So even with all these treatments, surgery, powerful antibiotics, and these other therapies, it sounds like this could still be pretty dangerous.
Unfortunately, necrotizing fasciitis does have a pretty high mortality rate, even with aggressive treatment.
Wow, that's pretty scary. I mean, a high mortality rate even with all that.
Yeah.
What are some of the things that determine how well somebody recovers from this?
I mean, a lot of things, really. I mean, obviously, how bad the infection is. That's a big one. How quickly treatment starts, obviously, that's crucial. And the patient's overall health and any underlying conditions they might have.
So it's not just the infection itself, it's also like how strong the person is going into it.
Right, exactly. And even with, even if the treatment's successful, there can be some long-term consequences.
Like what kind of things are we talking about?
Well, it really depends on how much tissue damage there was. Somebody might need multiple surgeries.
Oh, wow.
Skin grafts, even amputation in some cases.
Wow.
Yeah, so recovery can be, it can be a long road.
Yeah, definitely. Well, we've talked about the causes and the symptoms and the treatment and all that. But there's one thing that I just keep thinking about. It's like, this can happen to healthy people?
Right.
From that seems like a minor injury?
Yeah.
I mean, what's up with that?
That's one of the I don't know, most intriguing, frustrating things about this whole condition, really.
Why frustrating?
Well, because we don't have all the answers.
Oh, okay.
You know, researchers are still trying to figure out why some people get it and some people don't.
Right.
Even when they're exposed to, like, the exact same bacteria.
So it's not just bad luck.
It seems like there's more to it than that.
Okay.
You know, that could be a number of factors at play.
Yeah.
The specific strain of bacteria could be part of it.
Okay.
You know, some strains are just nastier than others.
Okay.
Also, the person's, you know, their genetic makeup.
Right.
Some people might just be more susceptible to this kind of infection.
So it's a combination of things that we don't fully understand.
Yeah, that seems to be the thinking right now.
Okay.
And, you know, there could be environmental factors, too. We don't have the complete picture yet.
So it sounds like there's more research to be done?
Oh, absolutely.
Okay.
Yeah.
So in the meantime, what's the takeaway for our listeners?
Yeah.
What should they be doing to protect themselves?
Awareness is key. Understanding the risks, you know, recognizing those warning signs.
Yeah.
That's crucial.
So not panicking, but not ignoring it either.
Right. Yeah.
Okay.
Like if you've got a wound that's not healing, right? If you're having intense pain, swelling, any of those things we've talked about, don't mess around.
Yeah.
Go see a doctor.
Better to be safe than sorry.
Absolutely. Especially with something like this.
What about prevention? Is there anything people can do to lower their risk in the first place?
Good hygiene's always a good idea.
Okay.
Especially if you have any kind of open wound. Keep the area clean and covered. If you've got any health conditions, make sure you're managing those effectively.
Right.
And just be mindful of your risks, especially if your immune system is compromised.
So it's about being informed and proactive, not living in fear.
Exactly. Exactly.
Well, this has been really informative.
Yeah.
I feel like I've learned so much about necrotizing fasciitis, you know, from the science behind it to like those personal stories.
Yeah, it's a complicated condition, but I think you know, we've done a good job laying out the basics, you know, what it is, what to look for, why early treatment is so important, and the fact that, you know, even though it's rare, we still got to take it seriously.
Absolutely. And I'm sure our listeners are going to have more questions.
Oh, yeah, for sure.
So where can they go to learn more?
There are some great resources online.
Okay.
You know, reputable medical websites. The CDC's got some good information.
Okay.
And as always, you know, if you're worried about your health, talk to your doctor. They can give you personalized advice.
Absolutely. All right. Well, that's great advice.
Yeah.
And on that note, I want to thank you for joining us for this this deep dive into the world of necrotizing fasciitis.
It's been real.
It has. It's been fascinating, if a little intense.
Yeah.
But we hope you found it informative and helpful.
Absolutely.
Remember, knowledge is your best defense. Stay curious, stay informed, and stay healthy.
Stay healthy.